So, I have an interesting question for you today. And that question is: do you get back to your inquiries that inquire on your website within 5 minutes? Okay, so that's the question. Do you get back to inquiries within 5 minutes? And I ran a poll at our most recent webinar that had about 300 doctors at it. And we ran this poll that asked people what happened after made an inquiry on their website. And we got back some interesting answers. In most cases, a human does eventually get into contact with the lead, but it certainly doesn't happen within 5 minutes. Okay. Uh, in the cases where it does, those centers might have a call center or dedicated staff ready to answer phones, and they have enough of them so that they have capacity to take in new calls even while other team members are on the phone. So this is a challenge, and this is a significant challenge for people in business, and specifically for people in vision correction businesses. So I wanted to spend some time talking about it. And also I wanted to spend a little bit of time talking about a solution that you might find valuable to look into if you wanted to actually get back to your inquiries within 5 minutes. So let's get into this. So what happens when a visitor makes an inquiry on your website? And again, sometimes it can include an automatic response. It can include a voicemail. It could include, let's say somebody fills in a form, they get an email. It could be a chat interaction. But the reality is that most people aren't very good at getting back to inquiries. So clinic staff aren't good at handling new inquiries. Why do I know this? Because I've been working with clinic staff for about 20 years, on and off, various different clinic staff around not only this country, but also in many, many other countries worldwide. And what I've realized is that they aren't very good at handling new inquiries. By the way, it's not their fault. If someone trains them to do it and they understand how to do it, it often begins at hiring. If they were hired to do it, then yeah, you could say it's their responsibility. But the reality is that most people don't hire salespeople to do this job, and they certainly don't train those people enough. I would argue that a person who you want to answer your phones or handle your first inquiries, whether they come from chats or whether they come from emails, I would argue that that person is one of the most important people in your clinic. And why would I say that? Well, because they are directly tied to your income, and your income is directly tied to your profits. And the reason you're in a business is to make profit. So, I mean, there are a lot of other good reasons and the good things you can do along the way. But if you're not interested in making profit in your business, then you should get out of business and go work for someone else. So you don't hire salespeople. This is a challenge. And you also don't create operational systems to make it easy for people to answer the phone. So people aren't very good at picking up the phone. What you'll usually have in private practice is you'll have a person that you hire to help you. You might call that person a medical secretary. You might call that person an assistant. And that person will be responsible for lots of things. Because you're in a small private practice and you're trying to save money on labor, what you'll do is you'll task that person with opening the door in the morning, going through all your voicemails, answering the phone, being the receptionist, admitting people to your practice, giving people forms, changing appointments, following with people to book their post-operative appointments, do your billing, maybe put up a social media post from time to time. I don't know, lots and lots of different things. You might even get that person to actually do collections for you. Lots of different things that you get that person to do. And one of those things that suffers is picking up the phone, especially if that person is also seeing patients, like doing tests or, doing any kind of counseling. So that can be a big issue, and that's a lack and failure of an operational system. You haven't put in a system that enables you to have the right people in the right jobs to do different things that are important to your business. So that's the challenge. And look, they're not really good at the sales conversation. Again, unless you've had them trained by somebody like myself or somebody else who specializes in sales training, then you're not going to have people who are very good at having sales conversations, because that's what we do. We train people how to have sales conversations. And again, the main reason for that is because you don't get a lot of cold leads if you're not in the habit of getting a lot of cold leads. If you're not doing marketing, then you're mainly receiving inquiries from warm referrals. So these can be referrals from insurance, they can be referrals from other doctors, they can be referrals from optometrists. Maybe you get a lot of referrals from friends and family of the patients that you already treat. But because all of these people are warm, they don't challenge your people, right? You don't have to have ideal sales conversations. You can just have order taking conversations. Most of the time, people will call up and say, yeah, book me an appointment. You did my mom. Why wouldn't I go to you? But when you start going into cold audiences, in other words, when you start doing advertising, in other words, when you start trying to grow your practice, you'll very quickly encounter that cold leads are not the types of leads that you're accustomed to, not like the warm leads that you're comfortable with. And your telephone people are going to have a real challenge with those leads, because those leads, they're talking to people who are having sales conversations with them. And if you can't compete on that basis, you're going to spend a lot of money on marketing. And unfortunately, most of that money will be wasted because your people will not be able to have good sales conversations. And therefore, your conversion rates will suffer. You may be accustomed to a conversion rate of close to 80 or 90% because you're used to warm referrals. But as soon as you start getting cold leads, all of a sudden, you're going to start seeing your conversion rate dwindle down to something like 10%. Now you can increase that. You can augment that if you have training to have good sales conversations, but it's unlikely if you don't. And they're also not good at following up on inquiries. And this is a big challenge, because with a cold lead, they're unlikely to book an appointment immediately, but they might book an appointment later. They're shopping the field, they're taking their time, and they want to make sure they make the right decision. So if you don't follow up with them, they will simply go and book an appointment with the person who does follow up. And listen, that's the number one reason that people stop marketing. You don't see the value because you're not getting the return on investment, so you blame the marketing. But the reality is the marketing was doing its job, because the job of the marketing was to generate leads for you. The job of the marketing wasn't to convert those leads, it was to generate the leads. And so the marketing did that. But what you and your people failed to do was to convert those leads. And when that happened, you decided, well, this marketing thing doesn't work. Even though everyone in the practice was doing the best they could. Okay? So, but they weren't doing what was necessary. They were doing the best they could with what they had. So they need more help. They need technology. They need training. They need processes to be able to do this. Okay, so why is this so important? Well, we know that 5 minutes is the magic number. So connecting and qualifying with cold inquiries within 5 minutes alone will dramatically increase your conversion rate from inquiry to appointment. We also know that about 62% of calls to SMBs are left unanswered. SMBs are small, medium-sized business. By the way, that's what you are when you're running a private practice. So any business that has, I think less than 250 people is considered a small business. And this chart that you're looking at here, it shows very clearly what happens when you get back to leads within 5 minutes. And this data comes from an MIT study that demonstrated very profoundly that speed to lead is everything. You can see here the number of leads that engaged based on response time and the number that engaged based on the 5 minute response time, 5 minutes or under, dwarfed the others. I mean, even by 10 minutes, you're starting to lose your opportunity because they've already engaged with somebody. And people don't want to engage with more than one person. They want to engage with one. So that's a big deal. And here you can see that after 5 minutes pass, the odds of connecting and qualifying an inquiry actually drop by 80%. Now, then when I learned about this number, it was a bit shocking to me because I've been spending the last 20 years training people how to convert people on the phone. And I just realized that the most important thing I should have been focusing on is getting them to respond to leads within 5 minutes. Because if they solely picked up the phone or responded to a lead within 5 minutes, conversions would have shot up. So that's a huge differentiator if you're able to make that happen. And responding to leads within the first minute increases your conversions by 391%. That is astounding. So all you've really got to do is just increase the speed to lead. I would say that's the most important thing you need to do when it comes to sales. If you want to convert your leads, increase your speed to lead, and you've got almost the whole thing done. Now, let's talk a little bit about healthcare. And healthcare practices are a little bit unique, okay? But let me give you a bit of a comparison in terms of how speedy different businesses are when responding to leads, okay? Or inquiries, I should say, because they only become leads once you respond to them and you acquire their information. So healthcare. In healthcare, it takes about 2 hours and 5 minutes on average for a healthcare practice to respond to a lead. That's far cry from 5 minutes. That's 2 hours and 5 minutes, all right? And by the time you've responded, unless you're in a city of one provider, the only provider who does what you do, and you can afford to act like a monopoly, unless you're in that situation, then you're going to lose that person to somebody else. Well, let's compare. Telecommunications, it's 16 minutes. With small size companies, 1 to 300, it's 48 minutes. In medium-sized companies, up to 2,500 people, it's 1 hour and 38 minutes. And in large-sized companies, it's 1 hour and 28 minutes. So if you look at this, healthcare stands out for how slow they are because they take forever to reply. It literally is forever when it comes to sales and marketing time. That's a lifetime. So what is it about healthcare that makes it unique? Well, it's all the reasons I mentioned before. Doctors are used to referrals from insurance, from other doctors, from word of mouth. And many businesses don't know that they need to consider, or rather, I should say, many businesses do know that they need to consider sales and marketing before they start a business. Doctors, on the other hand, they don't think about that. They're what we call accidental business owners. They fall into this mode of doing private practice. They don't even call it a business. They call it private practice. And when that happens, they don't initialize, they don't plan for, and they don't develop the processes that most businesses realize they need to do real quick, which is put in sales and marketing processes, right? So a doctor might come to me and say, hey, listen, I understand you got this system that might be able to help me with my practice. It's called Hattie. So can Hattie respond and qualify my new inquiries in 5 minutes or less? Is that something that Hattie can do? Well, the answer to the question is yes. So Hattie is a speed to lead specialist. When she receives a web chat message on your website, for example, that she provides as part of the service, is she'll actually respond to that lead with a two-way SMS with your visitors, and that SMS will go into their mobile. So she literally is responding to your leads into your mobile nearly instantly. In the old days, we used to have things like live chat where somebody would inquire and they would have to wait a really long time to get a message back. So they would get really bored and they'd move on and they close the website down and move elsewhere. But the beauty of this system is that even if they close the website down, they won't, because we respond before that happens, before they bounce. But even if they were to close the website, the SMS continues. So they can continue to have a conversation with your practice over SMS. Hattie can initiate that conversation and pass it through to you, and then you can continue the conversation with that lead. So that's great. And when someone calls you and doesn't get through, let's say you only have a few people on the phone and people can't get through to you. Well, Hattie's going to send a missed call SMS back to the inquiry. So what that means is that you're able to turn every missed call into a text conversation. So even if somebody reaches you while it's middle of the day and you're doing your best, but you're just busy with patients or on the phone, even if somebody doesn't get through because of an engaged signal, Hattie will get through to them on your behalf. How nice is that? So she will literally not leave one lead behind. She will respond and follow up with every lead. And when someone completes a call me back form on your website, she can automatically call them back. And so you don't have to actually respond to them by email or potentially call them back when you get around to it. You see, those people are in the mood. They're ready to go. So, and you know what it's like when you try to respond to a voicemail, the type of voicemail that people don't leave anymore because they don't like leaving voicemails. But you know what happens when you try to respond to somebody like hours after the fact, you can never get through to them. But Hattie does that instantly. So when someone completes a call me back form, she can automatically call them back. And then she can bridge that call with your staff when the inquiry picks up the phone. So consider her like a speed to lead specialist, somebody who can act on your behalf when your staff is too busy to do so, when you perhaps are too busy to do so. And Hattie will never leave a lead behind. How nice is that? So if you're interested in that, if you want to know more, lifsysolar.com/Hattie, Hattie. Book a demo. We can talk a little bit more about what Hattie can do, how she can improve your practice. And yeah, we'll leave it there for now. Thanks for joining. Bye for now.